Next up, which we're all here for today, is Sarah Galvez. I want to tell you a little bit about her. Sorry, Sarah Galvez. Apologize for that. Sarah Galvez is a highly qualified risk manager known for improving workplace safety and reducing accidents. She holds a Bachelor's of Science in Public Health and is certified as an EMT. With expertise in food safety, regulations, and community health, she has won multiple safety awards and maintains top-notch safety rates. Sarah shares her knowledge as a speaker and serves on the executive committee for the ASSP Utah chapter, advocating for safety and women in the workplace. With her leadership and dedication to safety, she is a valuable asset to any organization. Please welcome Sarah Galvez.
Thank you very much. I am Sarah, and I feel really privileged to be able to speak to you guys today about suicide prevention and awareness. It's something that I'm very passionate about. Let's see if I can do it. Oh no, what? Okay. So this course is actually going to be suicide prevention methods and real life examples. So we're going to go over QPR, 54321 grounding methods, and then real life stories with very different outcomes. So this is not a QPR course, but we will talk about what QPR is. So if you want more information on that, I'll give that to you afterwards. So when we talk about suicide, you're right, it's harder than it looks. Uh-oh. There we go. Okay. Maybe it'll work now. Okay, so when we talk about suicide, what are some of the words that we think of when it comes to suicide? Depression, mental illness, low, despair. Yeah, we think of those. Some words I will tell you that have always come to my mind until I started learning more about suicide were words like selfish, cowardly. That's how I was raised. Those were words that would come to my mind. Other people have said words to me like brave, and strong, courageous. In my mind, like sometimes we have to justify the death of a loved one, and maybe that's how they're doing that, you know, but we all think of suicide differently is the point of that. But when we talk about suicide, we need to think about the words that we use, right? We never know who's listening. We don't know what people are going through. There's always ears all around us. You know, at the grocery store, when you're eating at the restaurant, you never know who's listening and what anybody's ever going through. And so some of the words with suicide, when we talk about suicide, we say things like, oh, you know, they committed suicide. They had a successful suicide. They attempted suicide. They failed at suicide. And you need to change the way that you talk about it because those words have meanings associated with them, like completed, successful. Those are usually positive words. Failed is negative. And so sometimes in people's state of mind, like maybe they feel like they're a failure in life and they want to be good at something and they want to be successful at something and they're going to successfully kill themselves. Or maybe they feel like a failure already at everything they do. And it's like, oh, I can't even kill myself, right? I failed at killing myself. And so you have to change the words that you use. And some of those words might be like, you'll hear people who are passionate about suicide awareness and stuff like that. You'll never say they committed suicide. It's always they died by suicide. And I'll correct people when they're talking to me about suicide is they'll say, oh yeah, my neighbor committed suicide. I'll say, oh, they died by suicide. And so it's important that you start to change your verbiage when it comes to that. Instead of saying attempted suicide, you can say a suicidal act or a suicide survivor. Those are different terms that you can use. And sometimes, like, you know, suicide survivor, somebody could see that positive in a weird way, but a suicide act or somebody who had suicidal ideations, things like that. But you say died by suicide is how you would start saying that. So, okay, statistics. A QPR class, if you wanted to go through QPR, would have they're very heavy on statistics. You go through a gatekeeper course and it goes through a lot of statistics. This is just a little bit on the statistics. So suicides did go down in 2019 and 2020, or 2019, and then they increased in 2020. They increased again in 2021, and in 2023, they had more than 50,000 people died by suicide, which is more than any other year on record. And those are just the provisional numbers from the CDC as of right now. So it takes a while for the official data to come in. And so that's what the provisional estimates mean. But yeah, in 2023, more than any other year on record, you had suicides, with it being, it works out to something like one death by suicide, like every 11 minutes at that.
So Sarah, is that just US?
US statistics. Mm-hmm. So men have higher suicide rates than women. Men are more likely to use a firearm than a female. Females are more likely to die by suffocation. 29% females will die by suffocation as to 27% of men. And with the firearms, females are 33% and males are 58%. So you can see those numbers. And then a big thing right there too is the suicide by the age ranges. I was reading this morning in 2023 that there was a decrease in suicide among young people, which is actually really great. And it suggests that perhaps all these mental health efforts that we're putting out there for kids might be making an impact. So that's really promising. You know, my kids have a cousin on their dad's side, and she was 10 or 12 years old and she hung herself. I mean, at 10 or 12 years old, you know? And so to see that that is going down, that those provisional numbers are saying that, hey, there's a decrease in suicide in young people, really is a great thing. You see that suicides can be high with older people, especially older males. And they say that sometimes a lot of that is the stress and pressures of life and society, right? Like you're supposed to be a provider, you know, maybe people have gotten divorced, maybe a spouse dies, stuff like that. And then like we were talking about with the, what is that? They say more women attempt suicide, but more men actually die by suicide. And that is because more men are more likely to use a firearm. Women will take pills, they do the suffocation and stuff like that. So there's your statistics. And we're going to get on to the QPR. What is QPR? QPR stands for question, persuade, and refer. It is, like it says, it's a emergency mental health intervention. The QPR training is to help people to recognize the warning signs of a suicidal risk, and to help you ask someone to confirm or deny their suicidal thoughts. It's to help you reduce anxiety of somebody who might be suicidal, and then to enhance those protective factors and decrease those risk factors. And so that is what QPR is. Now going on to questions you ask somebody, right? Are you suicidal? That is an easy question, I feel like, to ask. Are you thinking about suicide? You know, I've asked many people that. The hard question is to ask somebody if they actually have a plan. I had a friend call me just a couple months ago, and she's bawling, and she's like, Sarah, I need to go to the hospital. I want to kill myself. And I know that I should ask her if she has a plan. She's in my car, she's hanging onto my arm, she's bawling, we're going to the emergency room. And the hardest thing for me to spit out was to ask her if she actually had a plan. So there's a difference between wanting to die and knowing how you're going to die. And when you go in for treatment, you go to the hospital or something like that, people who have a plan get treated different than people who just want to die. Having a plan is a very important question to ask somebody. It kind of lets you know where the seriousness of this is. How close are they to, how suicidal are they? And so that is a very important question to ask. So hard to ask, but it's very important to ask. Persuade. Persuade is like what you think it is, right? It's when somebody tells us that maybe they're suicidal and you know, oh, you have so much to live for, and think of your family and your kids and all of that stuff, right? But it's actively listening. It's acknowledging what they're saying, using those phrases, I want you to live, you matter, and then trying to create a plan with them, right? Telling somebody like, oh, think of your kids, think of your family, you have so much to live for, your life is so great. You want to acknowledge what they are saying, not just what you think their life is, right? It's really important that these people feel heard when you're talking to them. And then the most important thing is to refer, and I will say refer and report, right? If somebody is truly on the brink of killing themselves, call the police, call 988 with them, right? But refer them to resources, do these things. It's so important. I had another friend who he called me and he's like, oh my gosh, I'm best friends with his wife. And so it was like, he was like, I'm afraid she's going to kill herself. You know, I can't get a hold of her, all this whole situation. And I said, okay, well then why don't you call the police and have them ping her cell phone? And he's like, oh my God, she would be so mad at me if I did that. And I was like, but if you really think she's going to kill herself, at least she would be alive to be mad at you, right? And he's like, but you don't know that. And I'm like, well, but if you really think that it's that bad, isn't it worth it? So refer and report, you know, EAP programs at companies, you know, helping somebody find a therapist, like it went back to creating that plan. It is really, really important, because you can say all you want to somebody, but if you don't give them a way to get help, it's you know, it's helping remove a barrier by helping them create a plan and giving them resources. So like I was saying, you can take a QPR gatekeeper course online. It goes through all of this stuff. At the end of it, you get a little certificate, you scan a QR code or something, and they give you a certificate. And so you can go through this gatekeeper course and be a QPR gatekeeper. They also offer training courses. So if you want to be like a certified QPR trainer, you can do that as well. And this gatekeeper course, if you take it online, it's $29.95. It's not very expensive. And just Google like QPR suicide, and that is how you will get this information. Now, the next thing is 5, 4, 3, 2, 1. It's a grounding method. A lot of people with anxiety are aware of this method. Sorry. And so what it is that you look around and there's like 5 things that you touch, 4 things that you smell, this kind of thing. But we are going to go through it together so you know exactly what it is, and we're going to do it. So for 5, right, you look around the room, take a moment, you look around the room, name 5 things you see, right? It could be a poster on the wall, the fire extinguisher, maybe you look out the window and there's a car with the headlights on. So take a minute and name 5 things. Okay. And then 4, name 4 things you can touch, right? Maybe my pants, my hair, the clicker, a pen. 3, listen. What are 3 things that you can hear? right? I can hear something humming. I can hear my normal ringing in my ears, right? I can hear people chuckle. And then two things that you can smell. Somebody has some really delicious smelling coffee. Right? Maybe it's the person next to you. Maybe it's their hair, their perfume. Maybe it's a gross smell. Right? And then notice something you can taste, right? Now, what is really important to note is that suicide often happens in a 10-minute crisis. Somebody will decide to die by suicide during a 10-minute crisis. And if you can get somebody through that 10 minutes, a lot of times they don't make another attempt. That's not always the case, right? But a lot of times getting them through that moment of crisis will save their lives. It's crazy to think that in 10 minutes, and it's not like it's just suddenly 10 minutes, something happens and your life is so horrible, right? It's things add up, but it's that breaking point, but it's in that 10-minute moment of crisis that if they can get through that, they will usually make it. Not always, but they will often make it. And so that's why I like this grounding thing. You know, getting people to take a moment. Okay, let's 5 things, right? Take a moment. 4 things, 3 things, right? You're letting them breathe and reset and kind of gain a little bit of composure back. And so it's really, really helpful techniques, right? Same with the QPR, the questioning, persuading, referring, is that you're having a conversation and you're getting them through that 10 minutes and you're giving them a path forward. You're creating that plan. So next we're going to talk about our stories, our real life stories. Okay. And like this stuff is, it's real and it's sensitive, and I won't lie, you might cry. I might cry. I'm hit and miss when I cry. But so this is Andy. This is his Instagram post. It was his 38th birthday. Today's my birthday, another year older, reflecting on the past, excited for the future. You know, my life, everything's not great, but like I wouldn't be who I am today. Be positive, make someone smile, right? This is his 38th birthday, very positive Instagram post. Andy always liked to travel on his birthday. And this year he was supposed to go to Moab with his girlfriend and things didn't work out. And he's like, oh, what do I do? I was like, just go by yourself. It's like, it's great to travel by yourself. I travel all over the country by myself on a motorcycle. And I'm like, it is amazing. And he's like, I'm not like you, Sarah. I can't do that. I can't go on a trip by myself. But he did. He went on this trip by himself. He had a great time. He called me one night, called me 3 times, super drunk, met the most beautiful girls. He ended up going to Colorado. It was great. He had a really good trip. So this is June 8th. Okay. This is Andy and this is our son, Max. This is 10 days later, June 18th at the Garth Brooks concert. The next day was Father's Day. They went golfing. Monday morning, Andy brought Max home. You know, he went to school. Andy went to work. Everything seemed normal. Tuesday morning, Andy shot and killed himself. So this is the last picture that Max has with his dad. Andy, throughout the years, you know, we've had talks of like, are you suicidal? You know, are you thinking about making a permanent decision to a temporary problem? And one thing you will learn with suicide is that people who are suicidal do not see suicide as a decision. They see it as a solution. They see it as the only solution to end this pain and suffering. to me, like, you know, someone who does not understand that does not see how that is the best solution. But to somebody who's in that kind of suffering, that is the best solution. So Andy had called me late Monday night, early Tuesday morning, more distraught than I had ever heard him. And he told me what was going on, like what led him to that. And, you know, we went over things, and I said, he had driven up to Oakley, told me he drove up to Oakley, he has no ID, no money. And I asked him, I said, are you thinking about making a permanent decision to a temporary problem? And he said, I'm trying not to. And I said, think about your parents, like think about your mom and your dad and your brothers, your friends. I was like, Max, think about Max. I was like, that kid loves you more than he loves me. Like, you know it. And he said, Max is the only thing that has been keeping me hanging on this long. And then he changed. He took a deep breath. He calmed down and he said, okay, I'm going to go home. And I said, okay. I said, you need to check in with me in the morning. I said, if you don't check in with me in the morning, I am going to send people to your house. Do not make me send people to your house. He's like, I will check in with you. And so I got up that morning and I called him and he didn't answer, which is not a normal. He had a crappy night. Sometimes after a bad night, you know, he'd call in sick to work, and I texted him and he didn't answer. And I just really felt like something wasn't right. And I was like, I should go to his house. But then I was like, no, I should go to work. And then Max came upstairs as I said, hey, you know, I want you to call dad, text him like every 30 minutes until he responds. And then when he does, you let me know. And he goes, why? And I was like, well, it's Tuesday. He's supposed to pick you up today and I can't get a hold of him, because I didn't want him to worry, you know, but I was hoping maybe he'd respond. And all day long, you know, something just didn't seem right. Like at noon, I wanted to send the police for a welfare check, but I kept telling myself I was being silly. At 2 o'clock, I called his roommate, or I messaged her. I said, hey, you know, I'm really worried about Andy. I haven't been able to get a hold of him. She's like, yeah, he was sending me really cryptic text messages last night, but when I left for work, both of his cars were there. She goes, you should take Max and you should go to the house and check on him. And I said, no. I said, no, we're not going to do that. And she's like, well, I can't get there till like 3 or 3:30. And I said, well, I couldn't get there till 3 or 3:30 anyways either. So I'll just let you, you know, wait till you get home. And I'm sitting at home and I call his mom and I'm like, hey, you know, have you heard from Andy by chance? You know, like he had a really bad night. I told her everything that happened. And she's like, well, first things first, you know, she's like, I think we need to find out like if his cars and stuff were there. And then I got a phone call. I said, I need to let you go. And it was a detective. I said, why are you calling me? And he said, why did you call the roommate? And I told him everything that happened. And he goes, well, here's the deal. He's like, his cell phone's pinging at the house, but all the doors are locked. We can't bust down the door because the guy had a shitty night. And so he said he'd call me back if he got any information. I called Andy's mom back and she's like, oh, we need to know if his cars are there. I said, his cars are there. And she's like, how do you know? And I was like, they're there. Trust me. And then I got another phone call and I was like, it's the detective. And you know, it's interesting. It's like, everything's so different, right? Like it was a restricted number calling me and never answer restricted numbers. And I'm like, oh, I need to take this call. And it was a detective. And the detective let me know that they had made entry into the house and that Andy was deceased. And it's crazy because like all day long, it's like I knew something was wrong, right? But I kept telling myself I was being silly, right? I thought about calling the police the night before when he was in Oakley, but I was like, that's silly. And what am I going to do? Say, oh, he's in a white GMC somewhere in Oakley with no ID and no money. And I don't know, you know, like I tell myself that I didn't think Andy went to Oakley to kill himself, but on some level I must have, because I asked him, right? But I told myself like, oh, he would be so mad at me if I called the police. Oh my gosh, like he would never talk to me again, right? Like if I called somebody, if I reported him to somebody, he would be so mad at me, right? I talked myself out of it. I told myself I was being silly, right? And so all of that stuff, you know, in my opinion, you know, could play into this. I had to talk to the detectives. I was one of the last people to talk to Andy. So I had to be interviewed by the detectives and everything. And one thing, when I was talking with the detective, I had so many questions, right? I'm like, in mom mode, how do I get his body? What do I do about like Max's shots? What do I do? How do I get life insurance? How do I do this? How do I pay for this? And I said, I feel absolutely horrible sitting here talking to you about money. Well, he was inside. He's still in there, laying there. He's dead. And he said, do not feel bad. He said, Andy was not thinking about Max, right? He's like, you have to think about Max. You're Max's mom. He's like, Andy was not thinking about Max. And if he was thinking about Max, he was thinking Max will be okay because he has Sarah and Sarah is strong. And I tell you that because when people are in this suicidal mindset, when they are there on the brink, they are not the people that we know. They are not the people that we think like Max would never, or Andy would never do this to Max, right? This is not Andy anymore. His mind is so far past that he thinks Max is going to be better without him, or that he's not even considering what might happen. So all those times, like you hear people die and they would never do that to their family. They would never do that to their wife or to their kids. They are not in that mindset. And that's part of why the like creating a plan for people and asking them if they have a plan on how they're going to die and then creating a plan to help them get help is so incredibly important. So next, Eduardo. So I don't have a picture of Eduardo, but he knows I tell his story. And this is the difference between Andy and Eduardo. Okay. Eduardo came to me at work one day. I'm sitting in my office and he comes in and his jaw is clenched. He's shaking. His hands are in fists. He's very visibly agitated. And he comes into my office and he says, Sarah, he said, I want to kill my ex-wife. I want to kill her boyfriend and I want to kill myself. And I am just like, oh, geez, like, holy crap. Like, I didn't even know what to say. It was like just like anxiety, like, oh my gosh, right? It's not like he just strolled in. I mean, he's visibly agitated and he's in a mindset where it seems like something could happen. I don't know. And I'm like teamsing HR, like, I need EAP information like yesterday. Like, I'm like, oh my gosh. And I don't know what to say to Eduardo. This was years before Andy. This is years before any kind of like I've ever taken any kind of suicide prevention awareness, anything like that. And I'm doing, you know, the same stuff. Think of your family, Eduardo. Like, you don't want to do this to your kids. Like, think of your kids. I'm like, your kids are going to be orphans. And like, I'm just struggling. Anything I can say, right? Like, your kids are not going to remember the amazing father that you were. They're going to remember you as a murderer. Like, who knows if this is even the right thing to say? I have no idea, right? I'm panicked myself. And it was a triggering event for me because back in 2006, I was the victim of an attempted murder suicide. And so for him to come in and say that to me, it gave me emotions that I was not expecting. And so it was hard to talk to him about it. So I'm spitting out anything I can even think of. And, you know, we talked about family, all this kind of stuff. And I got him EAP information. I'm like, Eduardo, our insurance covers mental health visits, like therapy, 100% unlimited. Like, get some therapy. Like I will help you find a therapist. Here's EAP information, you know, and we sat. And by the end of the conversation, he was like, okay, I'm going to do this. And I'm like, okay, like, come back if you need more. And I just don't even know what I'm saying to him. Just anything I can think of that sounds like a good thing to say, right? And he left and I'm just like, oh my gosh. And I'm like, well, what do I do now? And I was like, do I tell somebody? Like, he came to me in confidence. Do I want to like violate his trust? But then I'm like, but it's an employee. So that makes it different. But what else made it different is like, I don't know Eduardo. Like, I know him a little bit, but I don't really know what Eduardo is capable of. Is he capable of killing somebody? You know, is he capable of killing two people and killing himself? Like, I have no idea. So I called HR I'm like, hey, this is the deal. They're like, hey, we'll loop in security. I went to his manager and I'm like, hey, FYI, Eduardo just told me he wants to kill 2 people and himself, right? So I don't know what he's capable of. I don't know what's going on. 2 days later, I was off work and I got a phone call from security and they said we had to call the police on Eduardo. And I never saw Eduardo again for quite some time. And I never knew, like it was months past. It's like, I don't know what happened to Eduardo. I don't know if he died. I don't know. I don't know if he got fired. I don't know what happened. And then one day I was walking into the building and there's Eduardo walking out. And I'm like, oh my God, Eduardo. I'm like, holy crap. Look at you. You're okay. Where have you been? And he said, I went to my home country. I needed to get some help. He's like, and I'm better now. And then he pulled a little trinket out of his pocket and he said, this is for you. He said, I want to thank you. He said, if it wasn't for you, I would be dead. He's like, because you talked to me, you told me how to get help. And because you told people, he's like, I am alive. He said, I would be dead if it wasn't for you. And the difference between Andy and Eduardo, right? I look at these situations. I know Andy, right? Andy wouldn't do this to Max. Andy wouldn't do this to me. Andy wouldn't do this to his parents. Eduardo, I'm like, I don't know what Eduardo would do. I don't know if he would do this to people, right? I didn't want Andy to be mad at me, so I didn't call the police. I didn't tell anybody. But Eduardo, it doesn't matter if Eduardo's mad at me, right? I told people and the police were called. And because of that, he was able to get the help that he needed. And I think that this is so important because so often, you know, like I said, we hear and we think like, we know these people, we know they wouldn't do this. I know he would never shoot himself. I know, right? Even though like, you know, I've asked Andy a handful of times throughout the years if he was suicidal. I never thought he'd actually do it. And so it's so important that we don't just assume that we know people, that they have so much to live for, that they would or wouldn't do something. You know, you should honestly, anytime somebody tells you that they're thinking about suicide, that you treat them like somebody that you don't know in the way of getting them that help, right? Calling the police or doing something like that. I would give anything to have my son have his dad, right? And have Andy, like, it'd be great. Max can have his dad and Andy could never talk to me again because he hates my guts. I would rather have Andy alive and hating me and never talking to me and have a difficult parenting situation so my son could have his dad, right? And so it's just so important that you don't get stuck into that mindset of, I know them, they wouldn't do this, they have so much to live for. You question, you persuade, you refer, and if it's really serious, you report, you call the police, okay? It is so, so important. And so kind of looping this into workplace safety and workplace wellness is, you know, people hear this story about Eduardo and they say, that is amazing. Of all the people Eduardo could have gone to, he could have gone to his coworkers, his friends at work, his manager, his HR, you know, his supervisor. He went to the safety person. And they're like, that kind of says a lot about your safety culture there, you know, and the environment that you have. And they're like, what have you done? Why do you think that is? And I said, oh, well, like I never really thought of it that way, but it makes sense to me that to be good at safety, you have to care about people genuinely, right? Like you can do all the technical stuff, but if you don't care about people, it doesn't matter. People can tell when you care. And, you know, we do toolbox talks and they do monthly worksheets and stuff like that. And sometimes these worksheets have nothing to do with workplace safety. It's all home and community safety, right? Toolbox talks have nothing to do with work. Maybe it's close to St. Patrick's Day, so it's about drinking and driving. It's a fireworks safety tips. It's, you know, close to Thanksgiving, so it's foodborne illness. It's, you know, ladder safety, but it's all at home. You know, it's hanging Christmas lights, lifting and lowering, but it's about, you know, rearranging the furniture and picking up kids and stuff like that. And I've had supervisors come to me and complain and say, you know, oh, this is stupid. This has nothing to do with work. It's a waste of time. Or drinking and driving. This is a Mormon company. I'm like, well, not all the employees are Mormon though. and even if it only, matters to one person matters. And I told them, I said, I have even had employees come to me and say, thank you. I appreciate, the toolbox talks about drinking and driving or about, fireworks safety. They're like, I feel like you care about me as a person. You care about me outside of work and not just at work. And so it's really important in your safety and your mental wellness programs that your employees feel like you care about them all the time, right? Like when we do safety training and stuff, I'm like, home safety is so important. Like you get hurt at home, you can't come to work, and not like because we got to get your shift covered or something, but because you can't earn and provide for whatever it is you provide for your family, your dog, to be able to buy motorcycle parts, right? Go to Disneyland. Like I care about you as people so that, you're safe at home and at work so that you can live the kind of lifestyle you want to live. And I always try to make the employees feel like I care about them as people, not just when they're doing well or when they're not doing well, and I think that's a really important part of any safety program or mental wellness program is that your employees feel cared about all of the time. And then lastly, I have some resources for you. That's the QPR website, 54321 method. This liveonutah.org has a lot of different resources. I went to their website last night and they have all these, several different like guidebooks, basically guide packets, whatever. Whether it's suicide for like retired military, children, just so many different categories. This liveonutah.org has a lot of really good guides on suicide prevention and mental wellness, different categories. And then the total safety, that came out the other year. I can't even think, Salt Lake Chamber came out with this. You go to that. Construction is the second highest suicide rate of all the industry groups. And so they have this wellness guide that just aims to provide different resources for the construction industry. And so there's a lot of good stuff there too. So you can just Google that and you'll find that. So, but yeah, that is my, I can go so far, so I tried not to go too far off topic. Do you guys have any questions? Because I can go on and on and on and in depth about stories and different things, and I try not to go too much.
I do have.
Okay.
So I noticed that sometimes, I don't know if this is gonna, I'm trying not to say that one, but I noticed that it's kind of like a trend.
Yeah.
I'm gonna kill myself, and then it sounds like the same way because they're like all together, so they all have the same thoughts or whatever. And so, what is the difference, or what is the limit between I want attention and I want to kill myself?
I think that a lot of that, like it comes down to that whole, do you have a plan? So there was a girl by my house. She was in the junior high, and I think she got hit and killed in a crosswalk. And then all the girls at the junior high and a bunch of girls at the elementary school, they all want to die. They all want to kill themselves. Like I got a phone call from the school. One of my girls was on this bandwagon, and the school even said that we don't think the girls are serious. It's all just something that it's a trend. It's what everybody's, talking about kind of right now. But, they said these are things you need to watch for, and some things like in teenagers, it's kind of an interesting thing to watch for, right? They say, and not even teenagers, but adults, is people who start to sleep a lot because they're depressed. And I worry about Max all the time, right? Because he has a parent that died by suicide, he has increased risks of dying by suicide. And so I probably worry about him way more than I even need to, but it's like, oh, he's sleeping all the time. But I'm like, he slept all the time before, right? Like his brother was the same way, right? They're sleep till 3, they're teenagers. But things like that, they become more isolated. They're sleeping all the time. They withdraw from the family activities, things like that. And then a lot of times, when somebody has made the decision to die by suicide, and maybe they've been really sad, withdrawn, distant, all that kind of stuff. And in the couple days before, they become really happy and re-engaged and stuff again. My kids, their cousin died. She was like that. She, 2 or 3 days before she died, her parents said she's talking about all these things she wants to do and all these plans that she'd had, and she had been very sad and distant. And then all of a sudden she was like back to normal. And then they found her hanging in the basement. So, but with the trend things, like it's important to ask those questions of if they have a plan, how they're feeling, why they're feeling this way. Like this girl that died in the crosswalk, these girls didn't even know her, and I'm like, why? But like you said, it was just a trend. It's not like it was their friend that died, that they were impacted or anything like that. And it's sad because in this day and age too, most of us know somebody personally who's died by suicide. Until 2 years ago, I didn't. It was always a friend's dad. It was somebody's friend. I didn't know anybody personally until just 2 years ago. But it's sad that most of us can say that we do know somebody who has died by suicide.
I think it's why us. I wish my kids would.
Mhm. I know it's hard. It's really hard. Like I said, I worry about Max all the time, probably way more than I need to. The poor kid, he's the baby, so he gets babied anyways, but then I'm compensating, because he doesn't have his dad, and it's probably all gonna he probably hates it. But, okay.
So, death is hard to deal with.
Mhm.
What do you say to someone who's had somebody in their life that's close to them die from suicide? Like, what do you say to them? Because, oh, I'm sorry, or how are you doing? Those are not things that you be there for.
Yeah, that's hard. I hate saying like, I'm sorry for your loss, right? If you've ever had anybody close to you, like a family member die, like you get tired of hearing that. And for years, I did not say that. After my brother died, I wouldn't say that to anybody because I just hated hearing it so much. But I had a friend, her husband died. I gave her a book that I had come across, and it was how to deal with the unexpected loss of a loved one. And it went through lots of different, it goes through all kinds of different stages and different ways that people died, car accident, suicide, and stuff like that. And for me, I felt like it was kind of like a learning process, and it taught me how to kind of help people out. And because a lot of times, so like I had a friend, her dad died by suicide. And she had said to somebody, she said, Sarah has never once asked me if I'm okay, but she asks me to go to lunch every day. She makes sure that I'm not alone. And so things like that is like, hey, do you need anything? Can I do something for you? Just showing up, just to hang out unexpectedly sometimes, or making those lunch plans, taking dinner, doing stuff like that, is how you can help people. And then also asking them how they're doing, how their mental health is doing. If they need to see somebody or talk to a therapist or something like that, is really good ways to show support for people. And to me also, one thing that's so important is that like everybody's there for you in the beginning, right? The first couple months, everybody's there. And then after that, everybody starts to go back to normal life. Is to still show up for your friends and support your friends 3 months down the road, 6 months down the road, because that grief doesn't go away. You just learn to live with it. And so remembering to be there for those people, same thing like your employees, right? I had an employee who had like a really bad injury one time, and, work is, HR's offering counseling for all these employees and stuff like that. And then they were doing a benefits thing. We were down in the lobby and they were changing our insurance carrier. And I lashed out and just started yelling at the HR lady. And because they were switching our insurance again. And I'm like, oh my God, are you serious? Like, I just switched all my doctors and blah, 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 blah. And she was like, you know what, Sarah? She's like, we never asked you if you were okay, like if you needed help. And this is months later. And so, this wasn't a death, it was just a gruesome injury, but making sure that you continue to check on people and your employees, same thing, like if, maybe somebody's acting different or that they've lost a loved one or something, is that months down the road, you still check in with them because they're going to be dealing with that grief for such a long time. So, anything else? Did I end too soon? Okay. 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 Well, yeah, so that's all I have. If you do have questions or you want, any more information or these resources, I'm sure you guys have my contact information and people can reach out and get it. So, okay, thank you.
Okay, and like Sarah said, if you would like her contact information, just reach out to us and we'll go ahead and get that to you. And thanks again, Sarah, because that was wonderful and amazing. And I'm going to look at some of those resources that she put up there for us. So the upcoming Start with Safety next month is going to be from the National Safety Council for Safety Awareness Month. We've got Daniel Nagel. It's going to be only web-based though. So if you're wanting to sign up for that, registration is now open and it starts at 10 a.m. on June 5th. And I just wanted to say thank you for everybody who attended in person and web-based, and have a great day. Can I keep this? Can I keep this for the reason? Because I took pictures of it.